Hi, my name is Susan. I'm a fourth-year medical student currently on a rotation with Dr. Ben-Zur, and I'm going to be going through how to conduct a patient encounter in this office with an emphasis on how to use the electronic medical record system, and that is called IMS in this office. So before you see a patient, you'll be doing a step-by-step process so that you're the best prepared to see them. So you will be assigned a patient to see along with a room number. And when you're assigned a patient, you will click this icon which says select patient. And then you can just type in the first few letters of their last name, and that will bring up a list of patients that fit those letters, and then you can select the correct patient. You can also type in their first name, which you see over here, and search. So this is our sample patient for this presentation. Once you find the patient that you are looking for, double click it. And then you will click Visit Note, which is right next or very close to the Select Patient button. And this Visit Note will bring up the note from the last time they were seen. So before you go in the room, you're going to be looking at the last time they were here. And one of the first things you'll look for is their complaint and HPI, which has a star. So obviously the HPI is why did I come here in the first place? Why was the patient seen in the office? And it will also have the date of the last time they were here, so you'll be able to see how long it's been since they were seen. In this case, you can see that the HPI is pretty short. It just says the patient no longer complains of dizziness. Right below the HPI, you will see current medications and the doses that the patient is on. So this patient is on a wide variety of medications. You will also see any allergies that they have and the reaction that happens when they're exposed to this allergen, social history, etc. And one good way to keep track of what information is in the note is with these tabs on the side. So if a tab is in blue, like complaint and HPI, that means that information is present in the note. So we have the HPI here, allergy is in blue because we have the allergy, review of systems, etc. So continuing along in the HPI, in the note, you will also see any changes that were made to medication. So this comes towards the end of the note after assessment. So you will have gone through each of these sections, reviewed them closely, but before you go into the room, you definitely want to just focus on HPI, current medications, and then their assessment and plan. So you could follow up with the medications that were made, medication changes that were made. So under plan, you'll see medication changes, and if the patient was told by us to make a medication change, there will be a red text in this section, and then you'll be able to follow up with the patient. Are you still taking that increased dose of blank or decreased dose of blank? And whenever there's a change, you should be thinking about adverse effects that the patient may be experiencing, or even if it's not a new medication, you could look at their current medications list and think about side effects that are common to that drug and ask about those. Another thing to look at in plan is what the plan was from the last time they were here. So in this case, they had future procedures to be scheduled, including a stress myocardial perfusion, PET, and a rubidium scan. So you can see if the patient was able to get those procedures done in the time frame between their last visit and the time that they're here in the office now. So kind of what I touched on earlier, before you see the patient, you definitely want to look at their medication list and see that they're taking all of these medications. And the reason that this is important is because when you're in the room with the patient, you're going to be going through each of these medications one by one. So it's good to have an idea of what they're on before you go in. So for instance, this patient is taking 5 milligrams of Bistolic, which is a beta blocker. So you could automatically start thinking about some of the side effects of beta blockers, like dizziness, feeling faint, etc. And you because you already know what medications the patient's on, you can start thinking about some of this. A lot of the times in the clinic, we will be there will be a lot of patients, and you will be expected to take the blood pressure of the patient. So these are just some images of the blood pressure machine that we use. So first, you're going to have the patient lie supine. Then you'll apply the cuff to their left arm and make sure, obviously, that the arrows are pointing in the correct directions. Next, you'll plug in this into the actual machine recording the blood pressure. And the default position of the blood pressure monitor is off. And then to take the blood pressure, you will move it up and in order to take the blood pressure. And then you will take then you will see the screen and click start. And then the blood pressure monitor will start recording the blood pressure. So this is basically what it says. And also, some patients may request that their blood pressure be manually taken. So you should definitely be comfortable taking a blood pressure with a sphygmomanometer and your stethoscope. And you will be able to find this in room 8. After the patient lies supine, you'll also be taking a standing blood pressure. So after you have their supine blood pressure, since the cuff is already attached and the machine's already attached, you can just ask them to stand up from the exam table, and then you'll just click the start button again, and then take their standing blood pressure and have their pulse as well. So now that you've had all of the pre-room preparations and you've taken the blood pressure, you will ask how the patient has been doing since their last visit. So some of these patients are seen frequently, like every couple of days, whereas others haven't been seen for several months. So you always have to keep the time frame in mind when you're asking how the patient's doing. When you review the chart, you will look at the review of systems that is from the last visit, and if anything is in red, that means it was a pertinent positive. So you will definitely ask about follow-up questions about pertinent positives from the last visit. And if they have a new complaint, you will ask about associated symptoms. A common cardiac complaint would be maybe they had an episode of high hypertension in the home, and when the rest of their home blood pressures have been in the normal range. So if they have new cardiac complaint of high blood pressure, you could ask, what activity were you doing before you took this measurement? Did you eat something really salty last night that might be contributing to a high morning blood pressure? So you'll always ask questions pertinent to the new complaint. Then you will, before diet and exercise, you will ask about any recent shortness of breath, chest pain, dizziness, headache, and palpitations. And regardless of the type of encounter you see, you'll be asking these questions because it's just pertinent to every patient that is seen here. After you ask these questions, you will ask about the patient's diet and exercise. So you'll be asking them, like, are you eating a lot of vegetables? How long are you able to exercise? And this could be either minutes or distance. Like, I walk 2 blocks before I run out of breath. Or I work out on the elliptical 45 minutes every day. So you always want to know what their definition of exercise is. And also, when you are educating them about diet and exercise, there is a patient educational book called Our Heart to Yours, which it's a booklet of about 20 pages that the patient can download from the website, Ben-Zur.com, and you could tell them about the booklet so that they can read more about ways to make their lifestyle more healthy. So once you're in the room, you're going to go through, after you've asked these questions, you're going to go through each medication in the current medication list and verify dosage and frequency. A lot of patients want to make like a blanket statement, I'm still taking all of my medications, but you'll often find that there are changes that they've made. So that's why you want to make sure that they're taking each medication in the list and verify the dosage and how often they're taking it. And kind of what I mentioned before, you always want to ask about adverse effects. Are they experiencing any changes in the medication, like fatigue, nausea, vomiting, rash, abdominal pain, etc.? Once you're done going through the medication list, you'll perform a focused physical exam as needed. So you, for instance, if you see that somebody has a past medical history of congestive heart failure, you'll be looking for JVD, pitting edema in the lower extremities, etc. You might listen for carotid bruits in somebody with a severe aortic stenosis. You'll just be doing the physical exam that's appropriate for that patient. And lastly, you will address any non-cardiac complaints. Sometimes patients ask like, oh, I noticed that my mole has been getting a lot bigger, something that's not necessarily cardiac, but that you still want to address during the patient encounter, you can ask last. However, a point about this is something that may seem non-cardiac may be cardiac in origin. So if the patient complains of something like heartburn, for instance, you might automatically jump to think that that's GERD. However, this could be cardiac in origin. You always have to think about ways that the presentation of pathology might differ from patient to patient. So 4 common patient presentations that we see in this office are uncontrolled hypertension, new onset palpitations, follow-up from a recent ER visit, or a pre-op and or post-op. And I just wanted to note that for uncontrolled hypertension, there is a video on the website that myself and the 3 other students listed on this presentation made, Clay, Julia, and John, which shows how to go through an entire patient encounter from start to finish. And it's in the student section of the website. So going back to the EMR, now that you've already finished seeing the patient, you're about to present to Dr. Ben-Zur. So make sure that you have the most recent or the labs open for that patient by clicking this Documents tab at the top of the EMR. And always have that open before you start your presentation for Dr. Ben-Zur. And you can make sure that it's the right patient because their information will be here. Next, you will have it, then you'll click back to the Visit Note Template tab, which you'll remember is in this region. And when you're presenting the patient, you'll have this sticky note of their supine and standing blood pressures. And when you start your presentation, you'll always start with patient's name, age, gender, pertinent past medical history, and a reason for a visit. And you're going to go through OPQRST for new cardiac issues. But however, if they're following up or they're a frequent patient visit, you may not have OPQRST to go through. From the review systems and physical exam, you'll just be pointing out pertinent positives. And make sure that you know about procedures that the patient has done, why they're being seen in the clinic frequently versus not frequently. Just make sure that you have a good grasp on the patient. And also, this is a good thing to notice too, is if you notice that the patient's overdue for some preventative measure like a PSA level or a colonoscopy, you can definitely mention that during the presentation. So this is a sample presentation for the sample patient and how we would go about presenting it. So you guys can read that here. One thing that I do want to note in this presentation is that it has this sentence, which is what I mentioned earlier, was things that you would ask for every patient, regardless of their chief complaint. So in this case, this patient denies chest pain, palpitations, shortness of breath on exertion, headache, dizziness. And you can see that he is still taking his medications and that he has no side effects. After the presentation, you'll start writing your note. So you'll go back into the visit note for the current visit, not the last visit. You will update the HPI, update the current medications, update review systems, physical exam, vital signs, and the assessment. So one thing I want to note about medications, so you will see that there's a section for current medications. So if the patient decided to stop taking a medication because of adverse effects, or the patient decided to change their dose because they weren't tolerating it well, you will double click current medications and make the appropriate changes. However, if Dr. Ben-Zur decided to change the medication, you will click the prescription tab, which was one of the tabs on the left, and make the appropriate changes there. And this will just change how the note looks for medication changes that were made. So I just wanted to introduce that concept, but this is how you would actually do it. So you will double click current medication. And this, again, is if the patient self-discontinued or changed a dose on a medication. So double-click current medication. Then you will select whatever medication was changed. And then you will click DC, or if they changed the dose, you will click change. And you will never click edit, just change. However, if it was DC'd by the patient, you will do DC by, and this will drop down, and you will click patient. And then when it's DC'd, you always go back 2 days before the current date. So in this case, if the patient was seen on 11/11, you'll go back 2 days to 11/9, and then you will click OK and save the changes. However, if Dr. Ben-Zur changes the patient's medication by increasing or decreasing the dose, changing the frequency, DCing a drug, any change that's made, you will click the prescription tab on the left. And then this will bring up a similar box, and you will click whatever medication it is and click change. And then double click, and then you will change whatever was changed. So as I mentioned earlier, you always select change, never edit. So this is the box that will come up when you change a prescription because Dr. Ben-Zur made the medication change, not the patient. So for instance, if the patient is told to go from taking it once a day to twice a day, you will change the daily to BID, so PO-BID, and you will click save. And that is one of the most important things about the EMR, is accurately documenting medication changes that were made, because whether the patient decided to change it or the doctor was told them to change it is an important distinction that is made. And that is the end of this presentation. Thank you.